Hello, everybody, and welcome back for another episode with Tea Time with Dr. Sahar. And today I'm really excited to share with you the 4 pillars of health that I investigate. And this is where I start with every patient. So you're not alone right now if you feel like the health and wellness world is so overwhelming. There's so much information. It feels like somebody's trying to sell you a supplement to take. Somebody else says this is the protocol you should be on. This is the watch you should wear to track your sleep. This is the peptide you should inject. There's just so much information that it's hard to know who to trust and where to begin. We are living in a time where there's so much information without any practical foundational steps on where to go next and how to approach our health. So my goal for today is to tell you the 4 steps that I take with patients so that you have a framework in order to understand how to approach your own health. So let's begin. Typically, there's 2 types of patients. The first type of patient is the person who has some kind of health issue. They either have bloating or eczema or hot flashes or weight gain or some autoimmune condition, and they want to get better. And they've maybe tried so many things and nothing has worked for them and they don't know what to do next. Or they're just kind of starting out and they want to see some alternative treatment for their condition. That's the first category of person. The second category of person is more of the health optimizer. They're pretty healthy generally, but they want to see how they can optimize their health even more so that they can live a really long and healthy life. These are the 2 types of people that we see, and I still put them through the same steps, the same system. So let's get started. Step number 1, getting a comprehensive baseline. The purpose of a comprehensive baseline set of labs is to investigate and look under the hood to see what your biology is doing right now. So this really includes looking at your blood chemistry, looking at your immune system, markers of inflammation, your hormones, your cardiovascular health, your stress response. All of this will give us the data to know what we can fix in order to create a personalized treatment plan for you. Step number 2, optimizing the digestive functioning. The dietary work that I do in practice really makes the most amount of shifts in people's health problems. So if you have any kind of constipation or diarrhea or bloating or brain fog or joint problems or mood disturbances or any kind of inflammation on the skin, there's usually a correlation with the digestive health. So what we do here is we do a food intolerance testing and we remove the food that your body can't digest. When we remove a food that your body can't digest, we notice that the entire system is able to heal itself better, and a lot of those symptoms and conditions resolve on their own. The science behind this is if you're eating a food intolerance that your body can't digest, it ferments and it putrefies in your gut. That fermentation process then creates inflammatory byproducts that can cause you GI gut issues, or they can go to wherever your genetic susceptibility is. For some people, it's their skin. For some people, it's mood disorders. For other people, it's autoimmune conditions. So what we find typically in medicine is people are trying to take supplements or medications to counteract symptoms that are literally arising from what they eat. So when we can do the dietary evaluation and remove the food intolerance, the body will heal and the results will last a lot longer. Third category, sleep. What we really want to do is prioritize high quality sleep. Most of us know that we should be sleeping good, but it's a lot harder to actually take action in order to get there. So what you really need to ask yourself in order to do a mental inventory of am I sleeping good or not is A, are you falling asleep easily? B, are you staying asleep throughout the night? And 3, are you waking up feeling well refreshed? If the answer to any of these are no, then you have a problem with your sleep that needs to be addressed. Now, there's 2 components to this. Usually if you have any issues falling asleep, it signifies that you have some kind of stress response that we need to fix. Either we need to adjust the morning cortisol, or we need to just get you to be in a more relaxed state before bed. This stress response that we have, this hustle and bustle when we're working all day long is super great, but it's not very effective for helping us wind down in order to go to bed. So we help people, give people tools in order to calm down their brain, calm down their nervous system, do a little bit of mindfulness before bed so that they can go into a relaxed state. Of course, then you have to also make sure the external ecosystem is looking good. You want to make sure the room is dark. You want to make sure the room is cool and quiet. And both these things, fixing the internal psyche to calming it down and making sure the external ecosystem is suitable for sleep, will help promote deeper quality sleep. So sleep is where we are recovering, it's where we're detoxing. So we want to make sure that's dialed in. But if you don't feel better at this point, this is when you move to step 4, investigating other factors. What this includes is there might be some underlying factors like toxins, like mold, infections like parasites or microbial overgrowth that you have going on in your body that need to be investigated further. So at this point, we might recommend specialty testing to rule out any of those factors. Then if they're positive, we treat them. And at this point, we notice the remainder of people start feeling like they've reached optimal health. So in conclusion, I think that these are really exciting times that we live in. In the past, you needed to go to your doctor in order to access any information about your own health. But now you can do your own research. You can listen to podcasts. You have all these tools that tell you how you're sleeping, how you're feeling, how much movement you're getting. It's really exciting times, but it can also be information overload. But my goal with this video is really to offer you a framework in order to understand what steps you can take and in what order so that you can be an active participant in your own health. Because the truth is, you really don't need a medical degree in order to understand your own body. That's like saying you need to be a mechanic in order to know how to drive your own car. It's far from the truth. But we don't need to be blown in the wind by all the latest and greatest new approaches that we see on our phones, on our social media, because that is overwhelming. Start with the basics. Start with the foundation. This body has an amazing regenerative capacity to heal itself when you give it the right inputs. And then after that, you can reach for the fancy higher shelf items that are available to you. So this is Dr. Sahar signing off, and we'll see you on the next Tea Time.